I'm Tim McFadden, and I think most of you know I'm a doctor. I work as a psychiatrist at Oaklawn and Elkhart, and I wanted to give testimony this morning because I've seen God's faithfulness and the courage of my patients and my coworkers. The past 12 months have been hard for healthcare providers for sure, and I thought about that a month ago when the opening prayer at Creekside called for us to be lifted up from the illness of the world. And that phrase caught me because sometimes the illness of the world is actually illness. We don't think about that in this day and age because I think we take our safety for granted. When I was in medical school, I learned that it wasn't that way even a few generations ago. I learned that at the start of the 20th century, almost every extended family had lost someone to infectious disease, and most of the time it was more than one person. And at the start of my career, I remember meeting an old woman who had had depression most of her life. And it started when she had lost a newborn baby to an infectious disease and 5 days later lost a 2.5-year-old son to the same illness. And I thought about those stories at the start of the pandemic, and I thought, I wonder how we will handle that in this day and age when we don't have to deal with that very much. And I worried about how my patients would handle it especially. At Oaklawn, I have an intensive services team, and I'm responsible for treating some of the most severely mentally ill people in Elkhart County. And I remember telling my colleagues, those people don't have very good health habits and they don't have good self-perception at all. And I thought we were a setup for having an outbreak. Then on top of that, at the very beginning of the pandemic, one of the nurses on my team got COVID-19. She was one of the first people to get it in Elkhart County. And she missed 6 weeks of work. And my team was pretty rattled by that. And we had one nurse who was pretty angry that we didn't have the same kind of protective gear that the hospitals had, and he let everybody know it. And there was about a week that I wasn't sure how my team would get through it in the long run. But we got through it in some ways that were very inspiring to me. We have a nurse named Pam who has asthma, and she didn't know how she'd react to COVID-19 if she got it, but she chose to stay in her position doing direct care with patients, even though she could have opted for something else. And we have a secretary named Janie who's well past retirement age, and she chose to stay and work even though she could have walked away from the whole thing. She said it didn't seem like the right time to retire. And then we have a nurse that works in Goshen named Betsy, and in the last 4 months she lost her aunt to COVID-19 and 2 of her cousins and almost lost her mother, but it hasn't changed anything that she has done. And then the nurse Carolyn, who had COVID-19, she came back to work and she worked full time, and even though it was about 2 months until she started to feel like her old self. And all of those people have a sense of calling, but they come to work and they work every day and they get the job done. And my patients have been inspiring to me too. The patients we have in the apartments, they've been mostly cooperative when we told them how to take precautions, even when they had to quarantine. It's really surprised me some. It's been months since I've heard anybody complain about wearing a mask, and I can't tell you how many times people have said, "Dr. McFadden, how are you doing?" Then in September, one of our residents came down with COVID-19 and she had a serious case. She went to the hospital and she was in ICU for 3 weeks and then she died. And even then, the people in the apartments, they didn't freak out, but they supported each other. I have a patient, her name is Kim, and she has post-traumatic stress disorder. And she's been through more grief and suffering than anybody should have to endure. But she was the one who went the extra mile to reach out to the family of her friend that died. And sometimes people ask me how I can stand to be a psychiatrist and talk to people who have depression and anxiety every day. And I tell them it's not that bad because some of the people I know who have depression and anxiety are the most courageous people I know. They have suffering every day, but they find a way to make it. And for the same reason, I see God's faithfulness in the living love of Christ in people around me every day. So I don't think we need to wait until COVID-19 is completely gone before we give thanks to God. I think even in times of hardship, we see blessings every day. And I see those blessings in my patients almost every day, and I see those blessings every week at Creekside.